Intermountain Healthcare volunteers are finally allowed to return to the hospital.
As with many things during the pandemic.
Yeah, Intermountain actually had to get creative with the virtual visits. I'll take this. But as news specialist Jed Bowles shows us, these helping hands can once again meet face-to-face with some of the patients. Jed?
Yeah, Mike, this was a celebration of the return of the volunteers to the hospital, but it was also a celebration of a very important peer support program. That program connects current patients who are going through a very serious medical setback with former patients who know exactly what they're going through.
It's just about people helping people.
It's called RAMP, or Rehab Advocates Mindset Mentorship Program. In the peer mentoring program, former patients from the neurospecialty rehab unit at Intermountain help current patients overcome barriers.
So they have that empathy and understanding that we don't have as healthcare providers.
Bonnie Larson started RAMP 3 years ago. As an occupational therapist, she was already introducing past patients to current patients. The peer volunteers help rehab patients cope with their new lifestyles after a spinal cord injury, a brain injury, or paralysis.
They weren't sure how their life is going to be, but then once they saw it, they really were able to push forward.
As part of the celebration, former spinal injury patients and current mentors, Garrett Dore and Sarah Child, performed this dance.
Having to learn how to be creative with the body that I now have.
They can now go back to one-on-one coaching and counseling.
I can take my injury and take these experiences that I've gone through and help lead somebody through the darkness so that they can see that it's not the end.
Her dance partner, Dore, knew that darkness.
When I was put in this wheelchair, all my confidence was just thrown out the window.
After he adapted, he realized he could help others.
They'll know, hey, he's done it, why can't I? It's only impossible because it hasn't been done before.
Yeah, and that kind of influence helps the current patients carry on. During the first year of RAMP, they had 14 advocates, all of them volunteers. This year, the program is expanding to 30 of those volunteer advocates. Guys?